Dear participants, it's a great pleasure for me to welcome you to this Info Day on the Horizon Europe Health Cluster. My name is Irene Norstedt and I'm the Director of the People Directorate in DG Research and Innovation. The Health Cluster, or the Health Programme, is the shared responsibility of 4 Commission Director Generals who are working closely together to deliver the Health Work Programme. I would like to welcome my colleagues Maya Matthews from DG Santé, Wolfgang Philipp from DG HERA and Lorena Bois Alonso from DG Connect. My colleagues will also be addressing you in a moment. Let me start by saying a few words about what you can expect from this Info Day. The purpose of this event is to present you the 2023-2024 work programme of the Health Cluster and the rationale behind it. You will be given an introduction to the research and innovation topics in the work programme, as well as the opportunity to ask questions in a dedicated question and answer session. Sessions on cross-cutting issues relevant for all applicants will also be made available to you. The 23-24 work programme was published on the 7th of December 2022 on the Commission's Funding and Tenders portal. Today's event will mainly be focusing on the 2023 call, which opened on the 12th of January 2023. The deadline for submitting proposals to the 23 call is the 13th of April in 2023, except for the Partnership on Rare Diseases topic, which closes in September. The results of the 2023 call are expected in early August 2023. Just like the first work programme of the Health Cluster, Work Programme 21-22, the present works programme covers 2 years and it's divided into 6 chapters or destinations. Each destination aims to deliver specific health-related impacts and are the Health Cluster's contributions to the first Horizon Europe strategic plan covering years 2021 to 2024. This work programme specifically targets research and innovation needs identified by the strategic plan that were not addressed by the first work programme that covered years 2021-22. In the area of health, the Horizon Europe strategic plan primarily aims at supporting WHO Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. As a successful applicant to our calls, your project should help to realize the goal of the first Horizon Europe strategic plan and help deliver solutions to health challenges that will benefit citizens in Europe and beyond. Let me now give you a brief overview of the content of the work programme. The first destination addresses the prevention of diseases in older Europeans as well as in younger ones living in an increasingly digital society. Focus is both on physical and mental health. Destination 1 will also support the development of personalized disease prevention approaches. Destination 2 aims to improve our understanding of the links between environmental degradation and the health impacts. Focal points in these destinations are the concept of planetary health, the health impacts of air, noise, light and waste pollution, endocrine disrupting chemicals and occupational health in today's rapidly changing workplaces. Destination 3 addresses gaps in our current arsenal of interventions to manage and treat non-communicable diseases. Important challenges addressed under this destination are palliative care, the link between infections and non-communicable diseases, under-researched high-burden medical conditions. Destination 3 also addresses the needs for research and innovation to prevent future pandemics and emerging or re-emerging infectious diseases, including antimicrobial resistance. My colleague from DG HERA will give you further information on this point in a moment. Destination 4 of the work programme aims at improving our healthcare systems, in particular the robustness of regular care in times of crisis, the access to health and care for vulnerable groups, the resilience of the workforce in the health and care sectors, and the environmental sustainability of our health and care systems. Destination 5 addresses the potential of new health technologies and, for example, supports clinical trials of advanced therapies, the bioprinting of living cells for regenerative medicine, the development of virtual twins and real-time data analysis for personalized disease management. Finally, Destination 6 aims at stimulating the European health industry by, for instance, supporting efforts to develop innovative health technology assessments, improve the interoperability of the European electronic health record with the European health data space, and harmonizing methodologies for assessing digital health technologies in Europe. I hope this brief introduction to the work program 2023-24 was useful to you. I now have the pleasure of giving the floor to my colleague Maya Matthews, who will give you DG Santé's perspective on the work program. Thank you for your attention, and I wish you a good meeting.
Thank you, Irene. I'm Maya Matthews, Acting Director in the Directorate General for Health and Food Safety, and I'm delighted to speak to you today. Over the past 2 years, our teams have worked closely together to connect health research and health policy. The COVID-19 pandemic has changed the way we live our lives and forced us to rethink the way we manage and protect public health and deliver care and treatment. From a health policy perspective, the COVID-19 pandemic has highlighted the need for more effective mechanisms to manage cross-border health threats at European level. It has exposed structural weaknesses in our health systems and supply chains, and a lack of investment into crisis management and preparedness. In addition, it has also underlined the importance of a coordinated approach at European level and the limitations to the EU's current mandate on public health. As announced by the President of the European Commission in her 2020 State of the Union address, the Commission will build a strong European health union in which all 27 EU countries work together to respond to health crises, to ensure that medical supplies are available, affordable, and innovative, and to improve prevention, treatment, and care for diseases such as cancer. The Commission launched the European Health Union project in 2020 as part of the response to the COVID-19 pandemic. The COVID-19 pandemic has taught us that we need effective, sustainable, resilient, and accessible health systems to ensure that citizens receive the health care they need. For this to happen, the Commission recognizes that the Member States must be supported in their efforts. Therefore, the European Health Union will better equip the EU and its Member States to better prevent and respond to future pandemics. It will better protect the health of EU citizens through improved prevention, treatment, and care. It will improve the resilience of Europe's health systems. Our teams work together to establish links between public health policy developments and Horizon Europe. I would like to mention a couple of initiatives which are ongoing. The first is the new legislation on cross-border health threats, which strengthens preparedness, risk assessment, and risk management. We also enhance the mandate of our 2 key EU agencies, the European Centre for Disease Prevention and Control and the European Medicines Agency, to be able to better respond to health crises. The Health Cluster contributes directly to this initiative by funding related research. Secondly, we adopted the Pharmaceutical Strategy for Europe in November 2020, which focuses on increasing innovation, access, and addressing shortages. The Health Cluster plays its part by supporting pharmaceutical innovation. Europe's Beating Cancer Plan was launched in February 2021 and has a strong research component in the Cancer Mission. And finally, I would like to mention the area of digital health and the Commission proposal to establish a European health data space. The Health Cluster Work Programme significantly contributes to digitalization of health in 2023 and 2024. In addition to these links between policy and research, we also try to align the financial instruments we have at our disposal. The EU for Health programme has a much bigger budget compared to its predecessor. This affirms our commitment to support member states in promoting and protecting the health of their citizens and building more accessible and resilient health systems. There are many opportunities for synergies between the EU for Health programme and the health cluster. We ensure complementarity. In particular, in the fields of disease prevention and health promotion, digital health, mental health, health systems, and non-communicable diseases. I encourage you to have a look at the work programmes of these funding instruments. Thank you very much, and now I give the floor to my colleague Wolfgang Philipp.
Thank you, Maya. Hello, everyone. My name is Wolfgang Philipp, and I'm the acting deputy head of HERA, the European Health Emergency and Preparedness Response Authority. HERA was created in September 2021, building on the lessons learned from the COVID-19 pandemic. The mission of HERA is to strengthen the ability of the European Union and its member states to prevent, detect, and rapidly respond to cross-border health emergencies by ensuring that key medical countermeasures are available and accessible. In order to do so, at HERA, we look at the whole value chain, starting from intelligence functions, support to research, innovation and development, all the way down to distribution and stockpiling, passing through production and procurement of medical countermeasures. HERA operates in two modes: the preparedness mode to anticipate and respond to threats before they turn into crisis, and the crisis mode, empowering HERA to coordinate and take action against health emergencies once they hit. In the preparedness mode, we have 5 main tasks revolving around threat assessment and intelligence gathering, supporting research and development, production, procurement, and stockpiling of medical countermeasures to ultimately ensure their availability. In crisis mode, if the emergency regulation is activated, HERA will take the necessary measures for the timely production and distribution of medical countermeasures. In both modes of operation, great attention is paid to international collaboration. Let me now spend a few words on the important contribution Horizon Europe provides to HERA. Horizon Europe is one financial tool for HERA to promote research and innovation to develop effective, safe, and affordable medical countermeasures for pandemic preparedness and response. Therefore, HERA is one of the 4 co-chairs of Cluster 1 and fully involved in the co-creation process. Over the period of 2022 to 2027, the budget earmarked from Horizon Europe to HERA is 1.7 billion euros. As you can see from the graph in the slide, figures decrease over time and remain stable, slightly above 200 million over the last 4 years. Over 2023 and 2024, with a cumulative budget of around 630 million, we have co-developed some topics under Cluster 1, looking at pandemic preparedness and therefore contributing to the objectives of HERA. In particular, topics contribute to the objectives of HERA in relation to medical countermeasures, namely for prevention, diagnosis and treatments, and beyond supporting CEPI's work to accelerate the development of vaccines against epidemic and pandemic threats, HERA, through the Horizon Europe program, will support projects aiming to increase knowledge on immunity induced by vaccines against viruses with a high epidemic or pandemic potential, as well as to define optimal vaccine design for pathogens, where information on host-pathogen interaction in viral surface structures is available. HERA will also support the development of and access to in vitro diagnostics for the detection and characterization of pathogens with a pandemic potential. Building on existing adaptive platform trials and cohort studies, HERA, in cooperation with DG RTD, will facilitate strategic coordination mechanisms in the Union and beyond to enable the conduct of perpetual platform trials and perpetual strategic cohorts in order to pivot to emerging diseases if an epidemic strikes and generate scientific evidence on different possible medical countermeasures. Moreover, other research actions for treatment will focus on advancing broad-spectrum antiviral compounds targeting viruses with high epidemic or pandemic potential. In addition, HERA, again together with DG RTD and in cooperation with member states, is involved in the preparatory phase of the EU partnership on pandemic preparedness, which intends to develop a strategic research and innovation agenda for pandemic preparedness by 2024. The upcoming One Health antimicrobial resistance partnership will also contribute to addressing one of the three main priorities identified by HERA, namely antimicrobial resistance. All in all, we need to further encourage investments in pandemic preparedness. The COVID-19 pandemic has changed history. Investing in preparedness and resilience is not a mere expense, it is a real investment that pays off. Cluster 1 provides a significant contribution to promoting innovation for being better prepared and able to prevent and quickly respond to any outbreak in the future. Thank you for your attention. I would now like to give the floor to my colleague Lorena Boer-Alonso from DG Connect.
Thank you, Wolfgang. My name is Lorena Boitz-Alonso, and I am the Director for Digital Society, Trust and Cybersecurity in DG Connect. I represent the co-chair for digital policies in the health cluster, and I would like to say a few words about the impact of Europe's digital priorities on this cluster. Let me start with this first slide. We are all aware that our society is becoming increasingly digital. And as everything which is transforming, whatever aspect in life, it comes with benefits and of course also with challenges. But here we would like to reassure you that the EU is committed to a secure, safe and sustainable digital transformation. We want that this digital transformation happens in accordance with EU core values and fundamental rights. What's the way we have to ensure that this happens? We have a policy program for the Path to Digital Decade, and this is setting up common objectives for Europe's digital transformation until 2030. These objectives are centered on skills and infrastructure, and also on digital transformation of business and public services. And one of the core principles in this policy program is precisely about putting people and their rights at the center of the digital transformation. And in the area of public digital health services, the program has a very ambitious goal, which is to provide online access to electronic health records for 100% of citizens by 2030. These digital principles and objectives are fully aligned with the aims of the Horizon Europe Health Cluster. So in particular, to support inclusive, secure and ethical digital solutions that will benefit patients and empower people to take control of their own health. Now go more in depth into the digital technologies across the care pathway. Let me tell you that, as I was saying before, digital technologies are being the main driver for innovation in the healthcare sector. The COVID pandemic is being something really to regret, and at the same time, it has brought an acceleration of the digital transformation of our society. And this has happened also when it comes to health research and healthcare provision. So we should keep this momentum and aim at maximizing the potential of digital health solutions so that we can achieve a high societal impact and cost efficiencies in the sector. And these benefits of digital tools, of course, span across the health and care pathway, from supporting individuals in making healthy choices to helping medical doctors tailor treatments for a specific patient in a way that minimizes side effects and ensures effectiveness. Let me give you an example. Artificial intelligence, advanced data analytics and apps in mobile devices can support healthy living, prevention, diagnosis, treatments and follow-up of patients. So the health cluster advances research in all these areas for the benefit of healthy lives, personalized care and patient empowerment. So now let me go to the role of data and the data strategy. The European data strategy sets up a new European way of data governance and forms the basis for the European health data space. The main principles of the data strategy are to facilitate data flows within the EU and across sectors, and something very important, which is to provide the citizens the control over their own data. That's absolutely essential. And the Data Governance Act is creating the processes and structures that help data sharing by companies, by individuals, and by the public sector. Then the Data Act clarifies who can create value from data and under which conditions. So the sector-specific common data spaces are fully aligned with what I was saying at the beginning of this presentation, with European values and rules on privacy, trust, and security. We need to do this in accordance to our own values. So to address the specificities of the health sector, the European Commission has come with a proposal for a regulatory framework for the European health data space. The idea is that this framework will ensure safe and secure exchange, use and reuse of health data, and this, of course, for better healthcare delivery, research, innovation, and policy making. Well, the Health Cluster Work Programme supports precisely better integration and use of health-related data, data quality, and utility label and interoperability of electronic health records. And these actions will bring valuable contributions and advancement to precisely the data strategy and the European health data space. And now let me go to the funding and the complementarity of the different instruments. Major digital health initiatives of the Commission are funded in a complementary way from a number of sources. We have the Horizon Europe program, the Digital Europe program, and of course also the EU for Health program. One such initiative is precisely the European Health Data Space that I was just mentioning, where funding is planned in all the three programs that I mentioned to support complementary research, and not only research, but also deployment activities. Another very important and forward-looking initiative is about creating virtual twins of the human. This is an amazing concept, a very beautiful project on which we are working. And this builds on existing computational models of individual organs and organ systems. And the idea is that it will be taken to the next level by building integrated models and using data from individuals. This will, of course, lead to better understanding of complex diseases, improved prevention, early risk prediction, and, of course, personalized medicine. The Health Cluster Work Programme includes precisely research and innovation on virtual twins. How? By supporting multi-scale computational model and to advance personalized disease management. And then let me come to the third area that I would like to mention. This is another wonderful initiative, which is the 1+1,000,000 genomes, where I must say that the member states have made an amazing progress in the past years. The Health Cluster Work Programme supports this initiative by funding research on genomic data integration for improved critical outcomes. And this is going to be, of course, extremely important. And this is precisely with this important project that I'm going to finish this presentation. I really thank you very much for your attention. On behalf of myself, but of course also on behalf of my fellow co-chairs of the Health Cluster, I wish you a very, very informative and fruitful Info Day. Thank you very much.
Good morning, ladies and gentlemen. After the policy messages by the co-chairs of Cluster 1, which are actually framing our activities in Horizon Europe in this cluster, we would like to continue with the information session. My name is Søren Børt, and I'm from the Economic and Social Transition Unit of DG research and innovation, and I'll be your moderator throughout the cross-cutting issues section in the next about 1.5 hours. What we will do right now is that we will show a short pre-recorded message by our colleagues in HERA, that's the Health and Digital Executive Agency, and Stefan Hogan will go through the activities that they are producing. Please.
Hello, my name is Stefan Hogan. I would like to present the Health and Digital Executive Agency, how the agency works with the European Commission and what it does. The European Health and Digital Executive Agency, HERA, is an executive agency established by the European Commission, which is operational since the 1st of April 2021. Executive agencies like HERA are set up and supported by the European Commission to manage funding programs on its behalf. HERA implements specific funding programs related to health, digital, food safety, industry, and space over the financial framework 2021 to 2027, with a total budget just over 20 billion under its responsibility over that period. HERA also manages projects launched through earlier programs such as Horizon 2020, Societal Challenge 1, Health, and the current staffing of the agency is 421 people. These are the programs that are implemented by the agency with the corresponding budgets. As you can see, a major part is dedicated to health. Firstly, to the EU4Health programme, which has a budget of 5.3 billion, of which 4.7 billion is attributed through the agency. And secondly, to the Cluster 1 Health component of Horizon Europe, with 4.8 billion, which is supplemented by 1.1 billion from the Next Generation EU initiative over the period 2021 to 2023, bringing the total amount managed by the agency to almost 6 billion euros over 7 years. I would now like to outline how the executive agencies work with the European Commission, in other words, who does what. In short, one can say that the European Commission defines policy while the executive agencies turns this policy into action. So the Commission defines the strategy for the various clusters in consultation with the member states, including the objectives and priority areas, and ultimately it translates this into annual work programs that constitute the calls for proposals. The Commission also makes key program decisions, including, for instance, approving the choice of experts attributed for the evaluations and selecting the projects to be funded, although this is largely based on the evaluation of proposals. And of course, the Commission oversees and assesses the work performance of the agencies. In complement, the role of the executive agencies is to manage the project lifecycle, publishing the calls for proposals, organizing evaluations, preparing grant agreements, and monitoring the projects. They also support communication activities and provide feedback for policy making. In practice, for HERA, this means launching the calls for proposals for Horizon Europe Cluster 1 and Cluster 4, as well as the Council mission. Organizing the evaluation of proposals by independent experts, preparing the grant agreements with the consortia of the shortlisted proposals, and monitoring thereafter the projects throughout their life cycle. So far, there are 190 projects now ongoing from the Health Cluster and for the Council mission, plus 74 in grant agreement preparation that are due to start in around spring of 2023. In addition, HERA monitors 420 ongoing health research projects from the earlier Horizon 2020 program. Here's an overview of the Horizon Europe Cluster 1 calls for proposals in 2021 and 2022, and their outcomes in terms of projects funded and funding allocated. In short, you will see that the agency has allocated some 986 million euros to 117 projects from the 2021 calls, and 851 million euros are expected to be awarded to 115 projects from the 2022 calls. Likewise, here's an overview of the Council mission calls for proposals in 2021 and 2022, which were actually both implemented in 2022. The outcome is that 125 million euros were awarded to 12 projects in the 2021 call, and 126 million euros are expected to be awarded to some 20 projects from the 2022 call. Thank you for your attention. Please stay informed of developments at HERA, and my best wishes in your endeavour to apply for EU research funding.
So, welcome back. As you can see, the HERA colleagues are a very important partner for us in terms of the implementation of the work program. And actually, most of the colleagues there are your most direct contacts. By now, you should have seen the presentations on the open topics for the 2023 calls in the website. And there's also some pre-recorded messages on that, which are very important for the evaluation of the proposals. So please, if you have not done that, please go through those and make sure that you already now start to put in your questions in Slido, because we would like to post as many of your questions or answer as many of your questions as possible during the session. The questions that cannot be answered right now will be posted in the frequently asked questions, to which there will be a link on the website. And there will also be the recording of this session that will be available later. You should also have the possibility to contact your national contact points. They're important partners for you, and they know most of the issues that we are also dealing with today. And if no solution can be found there, you can always contact the Research Inquiry Service, which you can find on the DG RTD website. But before that, we will have a short break, and then we will continue again at 9:40. Please.